Good afternoon, everyone, and welcome to Building Better Care, Women's and Oral Health Innovation. I'm Stephen Collins, the CEO of Matter. And for those of you who are new to Matter, we're a healthcare technology incubator with a mission to accelerate the pace of change of healthcare. And we do three things. We incubate startups, more than 1,100 of them over the last 11 years, from first-time founders to growth stage companies, and together they've raised more than $5 billion to get their solutions into the market and grow. We also work with large healthcare organizations, health systems, life sciences companies, payers, medical associations, to help them partner with emerging technologies as well as strengthen their own innovation capacity. And we convene the community, which is what today is. It's a place for people who care about healthcare innovation to learn from each other and work together to get things done. Today is special for us. It marks 5 years of our partnership with CareQuest Innovation Partners. We have been working together on a problem that gets too little attention: oral health and how oral health connects to everything else. 5 years ago, CareQuest came with a conviction that oral health has been siloed for too long, and that the cost of that siloing shows up in chronic disease, maternal outcomes, kids missing school because of toothaches, and they came with real resources to change it. And together we've built two programs, Smile Health and Accelerate, and the kind of partnership that we wish we had more of in healthcare, focusing on real needs with a long-term commitment to make the kind of change that our mission is all about. So thank you to CareQuest. Thank you all for being here and participating in this program. And with that, I'd like to hand it over to my colleague, Gina Konstantakopoulos, who will be our MC for the afternoon.
Thank you, Stephen. With that, I'd like to introduce our next speaker, Denise Marks, who's the CFO for our great partners at CareQuest Innovation Partners, as well as CareQuest Institute for Oral Health, who's going to give us some of our welcoming remarks. Denise, nice to see you.
Great. Thanks, Gina, and thanks, Stephen. I am thrilled to be here and really excited to share a little bit more about who we are and what we do. So, as was mentioned, CareQuest Institute for Oral Health is a national nonprofit focused on improving oral health for all. Through research, policy, education, and community partnerships, we work to create a more accessible, equitable, and integrated oral health system for all. CareQuest Innovation Partners is the for-profit subsidiary of CareQuest Institute, focused on innovation. CareQuest Innovation Partners funds, scales, and convenes startups and industry partners to advance accessible, equitable, and integrated care. Through programs like Smile Health and Accelerate, we help move promising innovation from concept to real-world impact. As Stephen mentioned, it's exciting to see how this community has grown, especially as we mark the 5th year of our Smile Health program in 2026. When we launched Smile back in 2022, we started with a clear question: how do we unlock innovation to make oral health more accessible, more equitable, and better integrated into the overall healthcare system? Because as Stephen alluded to, the reality is oral health has long been treated as separate. And we know that that separation comes at a cost. Today, the connection between oral health and broader health outcomes, from chronic disease management such as diabetes to maternal health, is undeniable. So we set out to build something different. Smile Health isn't just an accelerator, it's a platform for change. A platform that brings together startups and innovators with bold ideas, industry leaders who have the ability to scale, and investors and strategic partners who can help turn innovation into real-world impact. And over the past 5 years of Smile, we've worked with 24 companies across a variety of areas, including remote monitoring and imaging, pediatric and culturally competent care, oncology and other oral systemic connections, digital health and AI-enabled solutions, all driving towards impact to change the system of healthcare. And what's been most exciting isn't just the innovations themselves, it's what happens when these solutions are actually put into practice. And that's exactly why we launched Accelerate 3 years ago, because innovation only matters if it's able to reach the patients, providers, and communities that can drive that impact. Accelerate is designed to take promising solutions and test them in real world environments with real partners, real data, and real outcomes. And today you'll hear about one of these partnerships that through Accelerate with Young Innovations in Murnia, who is a 2024 SMILE alum. And this year, we're taking a very important step forward. For the first time, Accelerate is open not just to our SMILE alumni, but to other non-SMILE companies who operate within our areas of focus, who are ready to scale and expand into new markets. We're looking for companies who bring existing industry partners with an in-market pilot and will support them with up to $100,000 in non-dilutive funding, strategic advisory support, and the analytics needed to demonstrate both health impact and business value. Because importantly, we want to drive improved patient outcomes and reduce the total cost of care. And we know that oral health can do that when integrated with overall health. Because ultimately, that's what will drive lasting change, solutions that improve outcomes and can scale sustainably. Another critical piece of this work is collaboration. At CareQuest, we've built a strong ecosystem of partners across payers, providers, industry leaders, investors, and innovators who bring deep expertise and a shared commitment to improving health. And today's event is a reflection of that. You'll hear from leaders across the healthcare ecosystem who are tackling some of the most important challenges in oral health today. Access and investment is critical to advance these innovations. A case study in how a startup, when paired with the right industry partner, can make big advances in changing the ecosystem and advancing integration across medical and dental care, and specifically in maternal health. You'll hear directly from companies and partners who are already demonstrating what's possible when innovation meets execution. And finally, we'll share how you can get involved, whether you're a startup, a partner, or a collaborator in this growing ecosystem, because this work is bigger than any one organization can do alone. It's about building a healthcare system where oral health is fully integrated, innovation is scalable, and care reaches the people who need it the most. So thank you again for joining us here today and for being part of this journey. Gina, back to you.
Thank you, Denise, for kicking us off and sharing some of the great opportunities we'll be touching on today. I'm very pleased to introduce our first panel that will focus on access and investment in oral health. They'll explore how capital, public-private partnerships, and innovative care models really help expand access to oral health services, in particular for underserved populations. With that, I'd like to turn it to Julia Green, Director of Innovation Services and Programs from CareQuest Innovation Partners. Julia and group.
Thank you, Gina. Thrilled to be kicking off our first panel today on access and investment in oral health. Before I introduce our three esteemed panelists, I want to share some background on why this topic is so critical. Access to oral health remains deeply uneven. It's shaped by where people live, how care is financed, and whether systems are designed to reach those who need it most. Today, close to 60 million Americans live in dental health professional shortage areas, and access gaps are widening. Between 2016 and 2021, the percentage of children from low-income households receiving annual preventative dental care declined by nearly 10%. Among adults, disparities are even more stark. 43% of uninsured working-age adults have untreated cavities, more than twice the rate of those with private insurance. At the same time, preventative oral health remains significantly underinvested. Despite representing a $54 billion opportunity within a $500 billion dental industry, preventative dental care attracts less than 1% of total healthcare investment. CareQuest Innovation Partners is committed to changing this. In this panel, we'll explore how investment capital, private-public partnerships, and innovative care models can help to close those gaps, particularly for underserved populations, and what it will take to move promising ideas from pilots to scale. We are joined today by three incredible leaders who sit at important points in that ecosystem. Melanie Fernando, who is president and CEO of Aetna Better Health of Illinois, which serves more than 300,000 Medicaid members across the state. Kentucky Morrow, partner at Dental Innovation Alliance. Dia manages a $26 million early stage venture fund and has invested in more than 15 dental companies in just the past 4 years. And last but not least, Dr. Donna Bridge, who is a dentist and on the board of directors of the National Network for Oral Health Access, the nation's largest professional association of safety net oral health practitioners. Together, they bring unique perspectives across payers, investors, and safety net providers, and I'm excited to hear from them today. To ground us in today's reality, I'll start with Dr. Bridge. Dr. Bridge, what are some of the biggest barriers to accessing oral health care today, particularly for underserved populations?
Well, thank you so much for having me. I'm so happy to be part of this important conversation on oral health. From where I sit, the biggest barriers are pretty basic, but very real. People need coverage they can count on, a provider they can actually get in to see, and a system that works in the context of real life. Right now, as you mentioned, Julia, about 64 million Americans live in dental health professional shortage areas. And even in communities where health centers are working hard to save this safety net, many still just don't have the capacity to meet the oral health needs of the patients in their own service areas. So for these underserved populations, these barriers really add up very quickly. Even when someone technically has coverage, they may be dealing with limited provider participation, transportation issues, language barriers, childcare, work schedules that just make it impossible to keep an appointment. We also know, as you mentioned, that the burden of disease is not evenly distributed. National data shows untreated cavities are more common among working age adults without insurance than among those with private coverage. And low-income adults face some of the greatest cost barriers to dental care. Medicaid piece is particularly important here because children have a required dental benefit for Medicaid, but adult dental benefits are still optional for states. This means adult access is uneven and vulnerable. So from a safety net perspective, this is what health centers see every day. We're doing extraordinary work to meet patient needs, but we cannot solve unstable coverage and workforce shortages on our own. If we really want to improve access, we need stable coverage, reimbursement that supports provider participation, and care that's set up in a way that patients can realistically use.
Yeah. Thank you, Dr. Bridge. I think that's a great overview of some of the challenges across the system, particularly in the care delivery setting. I'd love to open it up to Melanie and sort of get her to share a little bit about the payer perspective. What role, Melanie, do you see payers playing in increasing access to care? And sort of how do you work with the state to reach members in underserved populations at scale?
Sure. So payers are one of the few actors in the system that can actually scale access, and largely because it's our unique positioning sitting at the intersection of state policy, public agencies, provider networks, and members. So as a plan, we really see our role in starting at how access is designed, not just what coverage is. So we usually work closely with the state to align benefits, remove friction with our membership and our providers and make sure oral health is treated as a part of whole person care. And as was mentioned earlier, is integrated. There's definitely opportunity in terms of public health messaging, in terms of our messaging and collaboration with the provider network on integration of oral health as a part of PCP visits, as a part of BH visits, as a part of our HEDIS measures, and just the AAP kind of annual wellness visit that we kind of start as that gateway opening visit to the member's care journey. So really having intentional conversations about that more intentional integration. Illinois is fortunate because we have the coverage for both adult and child. So I think we've expanded from there, and we're one of the most progressive states, I'll say, in terms of coverage, but we're still seeing, as an example, on the maternal population, pregnant women are accessing their oral health screenings at about a rate of 17%. So they have the access, but then there's that next step of actually the engagement and awareness and understanding. And we find that in going into provider offices, it's just not being talked about. So opportunities abound. I think in addition to just, again, like coverage and awareness, it's working with the data that we have. So we have eligibility data, we have claims, we have quality. So we can really see end to end where gaps exist, whether that's on the preventative side, low dental utilization, whether that's that missed prenatal oral health visit or just high ED visits related to dental conditions and lack of treatment. So once we're aware of those gaps, we can act and scale via a multimodal approach, whether that's doing kind of like a targeted program where we have high risk members in outreach, whether that's through members in care management and care coordination, or partnering directly with providers and community-based organizations to create more community solutions, whether that be school-based, mobile, or some more non-traditional delivery models that again go above and beyond traditional fee-for-service. And that's, I think, the beauty of managed care is that we're able to bring in kind of private investments to expand program coverage and really do proofs of concept over and above traditional fee-for-service. I think lastly, I'll just state that as far as effective programming, to give you an example, we launched what we call More for Moms Population Health Initiative, and we're able to see some material health outcomes just again by doing that sort of coordination with healthcare providers. So we know that moms that don't actually engage in oral health screening during their pregnancy are much higher risk of preeclampsia and preterm birth. So through this More for Moms Population Health program, we're able to give proactive education and then also offer digital and virtual visits to be able to provide that screening via phone or webinar. And through that focused effort, there was a 10% reduction in hospitalization and ED related visits for that maternal population related to oral health issues. So slowly moving the needle, and it's an ongoing effort. But again, those proof of concepts are really exciting from my perspective.
Yeah, that's an amazing outcome. I could probably spend an hour with you separately going deep on that, but really exciting result. And I love how you're thinking creatively about how to kind of connect across medical and dental to close some of those care gaps, especially for vulnerable patients that may not have the time or the resources to have another touch point with the health system. How do we make it easier and more convenient for them? I want to bring in a very different perspective from Kentucky and hear a little bit Kentucky on how investment capital can better be deployed to overcome some of these barriers, and how does an organization like DIA think about improving access and outcomes in oral health?
Yeah, it's a really tough question in a lot of ways. In that, when you think about innovation, there's different stages of innovation, and some of it's very early stage, and it is more supported by friends, family, and a dream, right? And then there's, I'll say, institutional capital that comes in to help grow, adopt, and scale that innovation that can help overcome some of those care gaps. And where I think we're seeing investment support some of those initiatives is number one, we're seeing some of the DSOs make direct investments themselves because they view it as a commercial opportunity. I think PDS in particular has done a good job now, rebranded to PDS Health, in terms of bridging the gap between dental medical integration and helping drive some of those initiatives. We're also seeing, organizations like CareQuest and some of the Delta Dental foundations or Delta Dentals themselves actively supporting that innovation. And finally, we're seeing greater participation, I'll say, across the venture ecosystem, not just for dental specific focused investors, but also generalists that are focused on healthcare more broadly, recognizing both the potential for dental to generate returns, but also the importance that dentistry has on overall bodily health. But I think ultimately, as we kind of think about the ecosystem as a whole, well, that's all very exciting. We're going to need a few proof points and exits to really help solidify a lot of that early momentum that we've been seeing in recent years.
Yeah, appreciate that perspective. And I know it's been a collective effort to think about how you bring more generalist healthcare investors into the oral health space. And I know something that we've been working on at CareQuest as well. It's really important to drive more innovation in this space. I want to move us to a quick lightning round and have an opportunity for each of you to share in around 1 to 2 minutes. If you could unlock one change in the next 2 to 3 years to improve oral health access, what would it be and who needs to act? And maybe Kentucky will stay with you and hear your response first.
If I could do one change for oral health access, I actually think DSOs are really well positioned to do that in a number of ways. And largely because I think in many ways they've built out a network, but they also have a cost structure that can better support access to care. And I think there's opportunities to establish public-private partnerships to that end. I think groups like Rodeo Dental have been a great example of how you can create Medicaid-focused organizations and expand access to care to, frankly, regions that were otherwise dental deserts, for example. But I think there's a real opportunity for DSOs to continue to fill that care gap in a way that's commercially viable that maybe isn't viable for solo practices. And in addition to DSOs, I think mobile dentistry and mobile dentistry groups have made a lot of progress there. And I think that also unlocks the potential for value-based care initiatives, but that's probably going to take much longer than 1 to 2 years.
Great perspective. Melanie, your thoughts?
I would love to see continued evolution of coverage of non-traditional care delivery models and alternative payment arrangements that are kind of state-led or CMS-led. I will say that we've piloted things like mobile anesthesia and like bundled arrangements, and again, more like at-risk arrangements, which have really driven outcomes and moved care into the community in a more meaningful way and minimize some of the barriers that were mentioned earlier by Dr. Bridge. And so again, just more formalization and adoption of that can help increase momentum and expand our ability to scale.
And Dr. Bridge, what would be one change that you would want to unlock to improve access to oral health care?
One thing I would want to see is stronger investment in health centers and safety net dental programs, right? With real support for practical innovations that meet patients where they are. We really don't need any more good ideas sitting on the shelf. We know what works. We know mobile dental care works. We know school-based care works, teledentistry, medical dental integration. It works, right? With that investment, however, one of the areas that needs help is operational support. A lot of health centers know exactly what need to be improved. They're trying to solve those problems with already stretched teams and limited resources. So that's what we need to kind of focus on. Policymakers, payers, funding partners, if we're serious about equitable access, I think we need to invest in organizations that are already doing the work and support them in expanding real solutions to get people care.
Fascinating. Well, three very different but important perspectives. I want to thank you all so much for your time on the panel today. I'm going to turn it back to Gina to introduce our next speakers. Thank you so much.
Thank you, Julia. Thank you, everyone, for just a fantastic conversation. We're now going to pivot to talk about Murnia and Young Innovations. So, this session highlights the partnership between Murnia and Young Innovations, showcasing how global collaboration can bring innovative oral health solutions to the US market. Murnia is a Smile alumnus and Accelerate recipient. And with that, I'm going to turn it to Jen Scanlon, who's the manager of Innovation Solutions and Services, to talk a little bit with our folks gathered here. Jen.
Yes, hi, thank you, Gina. Excited to chat today with Gulben Hubarex, co-founder and president of Umayana, the creators of Myrnia, which is an oral wound prevention and healing medicament with applications spanning oral mucositis, dry mouth, and post-procedural care, and Jonathan Espel, Director of Product Management at Young Innovations, a leading US-based oral health manufacturer and distributor with more than 500 employees globally. So excited to chat with you both today and talk through really your partnership through Accelerate, which brought an international oral health solution in Myrnia into the US with plans to reach 10,000 patients through CareQuest non-dilutive funding alongside significant in-kind commercial marketing and distribution support from Young Innovations to accelerate market adoption. So excited to dive in all things Myrnia and Young Innovations and talk through the partnership. So with that, Jonathan, can you share the origin story of the Myrnia and Young Innovations partnership?
Thanks, Jen. Glad to be here. Absolutely. So, Young Innovations is a 125-year-old plus company. We have a very long-standing history in preventive dentistry on the device side, but less so on what I would call the therapeutic side. So, as we were looking at investment and acquisition strategies to supplement our own development, development, by the way, takes somewhere between 7 and 10 years to recoup your investment as an organization. So oftentimes it's more strategic and quicker to partner with companies. And as I was building these roadmaps and identifying all these different technologies and startups, there was a pretty common thread among most of them that they were already on CareQuest's radar in some form or fashion through different insurance pilots or research type efforts. So we're like, well, let's get close to CareQuest here so that we can find these companies a little bit earlier. So we began partnering with CareQuest Innovation Partners in the Smile program. Now I think we're entering our fourth year, and we've had some really strong engagement, and that's how we found Myrnia. So during my strategic roadmap planning, I was really setting out to try to solve periodontal disease. It's a pretty big ask. There's a lot of ways to address it, but when we saw Myrnia's product portfolio, I had a narrower view on what I was thinking here, and I didn't realize the broader need for the technology that the Myrnia product brings to the world, really. So dry mouth, oncology treatment, side effects, aging populations, perimenopause, medication-induced side effects, and so many more things. These topics are really important to talk about, and we have an education platform, which is what we're really driving as our key commercial strategy for the Myrnia portfolio, and it's yielding massive audiences, bigger than our traditional products. And that's even true. We have a course tonight for special needs patients. So these topics are really important to expand and amplify those messages. So the product was really interesting, but when we started working with the Myrnia team, Golben, Julia, Linda, the framework I like to think about is people, passion, and purpose, and that team has all of it. They've all been affected by conditions that require treatment with a product like Myrnia, and it really shows in our collaboration. And I couldn't be happier to have partnered with Myrnia, and we're excited to help as much as we can.
Yeah, absolutely. I couldn't agree more. I think with the passion, people, and it really comes through, I think, in how you guys work together. And even when you, I think, first encountered them maybe through Smile, right? There was just, I think, a perfect storm of where you were in your journey and what you were looking for, where Myrnia was at their journey. So it really, I think, came together, and it's been amazing to see that grow and see them launch and market. I think has been an awesome experience from an outsider perspective. But Gulbin would love to hear maybe something a little bit more on the challenge side. What were the biggest challenges in bringing this solution to the US market, and how did something like Accelerate help overcome it? And of course, the work with Young Innovations as part of that.
Thank you, Jen. Very happy to be here. And as Jonathan said, these things take time development-wise, and we've been at this for a long time. We are very passionate about it. We do have a patented molecular compound that goes into it, sort of like Intel Inside, and has multiple benefits ranging from just maintenance of oral health to wound healing, and you can think about spanning cancer to periodontal diseases and xerostomia, dry mouth, those types of things. So a big product portfolio, and we are originally from Turkey, and that's where we started, have done a lot of the development, and we are in the marketplace. We do have a CE medical device in Europe, but as we kind of went through the SMILE program and became a finalist there, it was fantastic because we got the opportunity to see the US market. And of course, the US market is big and complex and very dynamic. And the way just the players making sure, understanding all of that, plus looking at our portfolio of products, just deciding on where's the need, validating the need in the United States market, which product do you pick, where do you go, and how do you do it? Actually, how do you execute it? Not just understanding it, but execution is extremely important. So those are the challenges, and it is honestly fantastic to be able to partner with Young Innovations. And Jonathan mentioned we are a good team, and I have to say that working with them through the SMILE program and graduating to Accelerate, knowing how we work together was very helpful as well. But it's a huge way for us to be able to sort of be able to crack the code and get into the market. And it's a true accelerator, both from a speed perspective and not just money, but not just the investment. It's who makes the investment, the team, how we sort of have the same mission, purpose, and how the team gels together to kind of create the go-to-market and leveraging that go-to-market expertise that Young Innovations brings through the Accelerator program has been extremely helpful to us.
Yeah, and I think it definitely shows in the success that you've had so far and the progress, even right with an accelerator program like Smile, there's maybe a few weeks to get to know each other and it's fast paced. And with Accelerate, you really have that time to really go deeper and grow that relationship more as well. So one last question as we're thinking about commercialization and scale, what's one lesson you've learned and what advice would you give to other companies, especially international innovators, looking to enter the US healthcare market? I'm sure we could spend a whole panel on this question alone, but would love to hear both of your responses.
Well, I'll start, Golben. And we didn't talk before, but the challenges she shared are exactly kind of what I've outlined too, is consider how much time and effort it takes to design, test, and validate those unique value propositions for the target market, not just for the products that you have, but how it fits into the healthcare provider's ecosystem and workflows. So a lot of healthcare providers know they have problems, but they don't know how to integrate something new into their practice-based workflows. Or so not only does a product have to work, but integration capability matters there. So that's a key thing that we've learned. And growth and commercialization is really, really hard work as it is. So even the simple things like quality and regulatory compliance, warehousing, distribution, how do you serve those customer bases? In the U.S., we're very we expect things to be done very quickly, and the customers want their product shipped overnight, all those types of things. You have to think about that, but that comes at a cost. So, are the prices set properly and all those things? And through this type of program, we're allowed to test all those variables and optimize the commercial strategy. So I think if you have the opportunity to leverage, I've got what, 6 people working on this project where, if you did this on your own, you'd have to get a lot of investors and that kind of thing to get this off the ground. So I think that in-kind investment from a commercial partner is, if you can do it, I would absolutely jump on it.
Yeah. And I can't second that enough. I think, like I said, not just the investment, it's the know-how is extremely important. And as I would agree with Jonathan that, investing that time in the regulatory go-to-market clarity is extremely important. And one thing I would say is that that market credibility from our perspective is also important. Young Innovations really brings that. Myrnia is new. A new brand is a tough one, right? Even though we have an amazing science there, it's just that credibility is going to take time, that market credibility. And Young Innovations' name is extremely important. Their expertise, what they've done, that's proven. So that is a huge help. But still, I would say one thing is, so having that is very critical, but also being very patient and knowing that trust building in the dental community through, especially the in clinical settings, is going to take time, and having that perspective of pivoting, learning, optimizing, and working with a partner that could do that with you, I think is the right formula for scale, successful scale in the future. So I would agree.
Absolutely. Yeah, I think from both of you, I'm hearing that integration and knowing how to work in the US market really matters, and having the right people to do it with, and the right expertise. So I think there's a great fit here, and appreciate both of you for taking the time to share insights and perspective, and really enjoyed the conversation. So thank you to Jonathan and Golden. I'm going to hand it back over to Gina to take us to the next panel.
Thank you, Jen, Jonathan, and Golban. So exciting for us to hear about products making their way to market and to patients, and the collaborations that make that happen. With this, we're going to now transition into our third panel, focused on maternal and oral health. So this discussion is going to really explore the intersection of maternal health and oral health, really highlighting opportunities to better integrate oral health into women's healthcare, address disparities, and talk about how this can impact mothers and infants. So I'm very, very pleased to turn this over to Katie D'Amico, VP of Growth and Innovation at CareQuest Innovation Partners, and an amazing collaborator in her own right. Hi, Katie.
Hi, Gina. Thank you. I know we're at the last panel of the day, so appreciate everyone sticking with us. I promise this one is worth staying for. So like Gina mentioned, women's health has been an increasing hot topic, very exciting, and the conversation is also extending beyond purely maternal health to also topics like prevention, healthy aging, chronic disease, longevity. But one area, you can probably guess what, still outside of that conversation is oral health. And it's a problem. We know oral health is one of the earliest and most accessible indicators of overall health. It's closely linked to cardiovascular disease, diabetes, pregnancy outcomes. Yet it continues to remain siloed largely from women's healthcare across the life course. And we're seeing consequences of this disconnect. Research shows roughly 60 to 75% of pregnant women experience gingivitis, yet fewer than half receive a dental cleaning during pregnancy, despite the clear clinical guidelines that support dental care during pregnancy. And so when these early oral health issues such as gingivitis go untreated, they progress into gum disease and We know and have seen in the data, gum disease is associated with an increased risk of preterm birth, low birth weight, and even preeclampsia. And some of on the first panel started to hit on some of this, but these gaps aren't evenly distributed. Women, children, families in these underserved communities are disproportionately affected, where dental care itself is harder or nearly impossible to access. So it is clear oral health matters, and today this conversation is about why it's still disconnected from broader women's health, and on a more optimistic note, where we are seeing momentum and where it's starting to work in practice. And so I'm very excited to be joined here today for this final panel with two exceptional leaders and partners to CareQuest who are bringing complementary perspectives spanning clinical and product leadership across women's health. So I will briefly ask each of them, starting with Dr. Lawson, to introduce themselves, and then we'll jump right into the questions.
Sure. Good afternoon. Thank you. So I'm Dr. Yolanda Lawson. I'm an OBGYN by background, and I'm an executive medical director for Medicaid markets with HCSC.
Thank you for being here. Sandra?
Hi, everyone. I'm Sandra Berger. My background is in public health, and I lead clinical programs and solutions for Cigna, which means I envision, design, and deliver programs across the healthcare continuum that support customers on their journey to better health, and that's inclusive of maternity programs. And I'm really excited to be here talking about this important topic.
Awesome. Thank you both for being here. So first question, Dr. Lawson, in your experience, including as an OBGYN, is oral health often overlooked? And, where are you seeing the biggest gaps in driving to this more integrated care today?
Sure, it is certainly often overlooked. I think many of the speakers in advance of us really kind of laid out some of the issues, and I can tell you from personal experience, it's often addressed only when there's a problem. And so that's what's most common. We know that about 40% of women have some form of periodontal disease. And so as we talk about the gaps, I look at this as opportunities. And so as we think about our dental and our obstetric clinicians, we should take advantage, number one, of the pre-pregnancy period. And so I'm always pushing if people can enter pregnancy in a better state, it's always better. And so taking advantage with the education piece. And so oftentimes, one of the biggest gaps is once a person is pregnant and they seek dental care, they often need a referral from their OB, right? And so oftentimes you just can't, when you're pregnant, just go to the dentist. You've got to have a clearance letter. And so that's another opportunity. How do we, and I'm speaking even for preventive services. And so that's another opportunity I see. And then lastly, I'd say education. Once I really sit with individuals and talk about those risks of periodontal disease on their pregnancy, but I go beyond that. I'm talking about, as you kind of gave some of the risk in pregnancy, I think about the spectrum after pregnancy. And so I'll be honest, once you have that conversation and they start learning, it could have an adverse impact on if they have cardiovascular disease, an increase in respiratory infections, diabetes, it's important. There's even newer research talking about its impact on Alzheimer's disease. And even because I'm a women's healthcare provider, osteoporosis of the jaw. And so once you start making sure people understand these other risks, they begin to listen. And so that's why the education is so important.
Thank you. And I'll just add on to it, the risks even extend beyond the mother. There's data that shows the link to the impact that it can have into adulthood for the child as well. And so really, really great points. Would love, Sandra, for you to build on that from your vantage point. Where are you seeing the biggest breakdowns today connecting oral and women's health? And also if you could hit on, why do these gaps continue to persist?
Yeah, absolutely, Katie. And from my vantage point as a health plan leader, I don't think the breakdowns are about a lack of evidence, but as Dr. Lawson mentioned, a continued need for education and because of the way the systems are built. Katie, as you mentioned, pregnancy is an increased time of vulnerability for oral health issues because of the hormonal changes. And not getting the care they need can lead to adverse outcomes for both mother and baby. And as was mentioned by Melanie and the other panel, there are certain groups that already face barriers that are disproportionately affected, like women of color and women with low income. And even though there has been progress with predoctoral education and professional societies getting the message out that routine dental care is safe and important during pregnancies, misconceptions persist and patients don't really understand this. And despite the evidence, oral health is still treated separately from women's health. The mouth is treated separately from the body. And as a result, as also was mentioned earlier, a lower percentage of women actually get dental care during pregnancy, and it's really important. So I see the breakdowns as follows. One, fragmentation among benefits and clinical accountability. Medical and dental benefits are administered separately, different networks, different workflows, and there's no single care team that has the accountability for oral health. Secondly, oral health is not consistently embedded in the prenatal visits. Those visits are time constraints and time limited, and the doctor's focus is on the obstetric risk because that's where their liability is. One of my OB colleagues said that when she was in training, they would tell her, well, just talk about this for a couple minutes. It's only a couple minutes. But if she added up all the things that were just a couple minutes, the visit would be 2 hours. And that's the crux of the problem. So why do these gaps persist? They persist because for decades, medical and dental care have followed separate pathways, separate training, separate workflows. And to integrate is going to take a lot of coordination and investment, whereas the benefits are downstream. So it's harder for the system to prioritize. Closing these gaps is really going to take intentional system design, aligning benefits, embedding oral health standardly and consistently into prenatal visits. Data integration and interoperability is another key aspect, and centering around equity.
Thanks, Sandra. Wow, could not agree more. And, building on that, Dr. Lawson would love to kind of start to look ahead. And we have a lot of innovators, startups on this call who have some of the solutions to some of these challenges and would love to hear your perspectives on, what innovation, partnerships, care models you've seen that are successfully improving and helping close some of these barriers that exist between the connection with oral and women's health.
Certainly. And so HCSC, we launched a maternal infant health initiative late 2023. And so this last fourth quarter in 2025, the initiative is ongoing. We integrated dental care into our maternal infant health initiative. And so one of our partners that we brought on was First Grand. Now they have a focus on the newborn. And why this is important is because poor oral health when you're pregnant, you have high rates of bacteria in the saliva that can transmit even to the placenta, uterus, cervix. So you know how you mentioned earlier this higher risk of preterm birth. That's kind of the physiology behind it. And so one of the things that we looked at with this partner is we're partnering them, distributing those kits to federally qualified health centers that have focused in large populations, of course, of obstetric patients. And so that way we're looking at educating moms also educating moms for their babies, because if we can do that and we reduce that risk, those babies, if they don't, and you transmit those bacteria, and this could be through just normal things you do as a parent, sharing a spoon, right? Those children actually have higher rates of dental caries later in life. And so that's an important work because we're partnering with these FQHCs, they're distributing kits, and we're actually tracking that piece. We launched in Texas, I think late 2025. We launched, implemented, and expanded in Illinois in January. And we just expanded to New Mexico this month. So, really proud of that work. Another thing we're doing is mobile dental health. And so, we have caravans. And one of the focuses on these mobile units is dental care. There are other services, but then we're thinking about how do we go to people, meet, we always talk about meeting people where they are. How do we penetrate deeply into communities where there's visibility and services and improving access to close those gaps? So just a few of the ways that we're working collaboratively to advance the effort.
Thank you. And in the spirit of collaboration, we have loved collaborating with you and the HCSC team on some of these initiatives. First Grin was one of our Smile alumni, and also some of this work has advanced through our Accelerate program. And so for the innovators on the call, these programs are pathways to drive to some of the impact that Dr. Lawson has talked about. Sandra, would love to hear from the Cigna perspective, how you have looked at different innovation and implementing it, turning from awareness to action.
Yeah. So I think integrating oral health into maternity at Cigna happens as a natural extension of our Healthy Pregnancies, Healthy Babies program. Through this program, we try to identify expectant mothers early in pregnancy and connect them with trusted nurses and clinical advocates to tailor education and support their journey to a healthy pregnancy and a healthy baby. So this presents a powerful opportunity to integrate oral health. And what we actually do as part of this program is we assess for dental health in those early conversations. And this provides us an opportunity to reinforce that dental care is safe and important during pregnancy, to help the expectant mother understand the impact on outcomes that dental health issues could have if left untreated and not addressed. And it also provides the opportunity to help them become more aware of the dental benefits and resources that are available to them and help them navigate. So when that comes from a trusted nurse at the right time, that can be really powerful in combating misconceptions and helping the mother really understand why this is important and normalize oral health care as part of pregnancy. And as an extension of that program, we also want to make sure that we're connecting education and action. That's why we offer tools and resources like Smart Scan and access to teledental services and Cigna Dental Virtual Care, because access can be a real barrier, both from a time constraint perspective. If a patient doesn't want to go to an extra visit on top of the time they're taking away from work for prenatal visits, or if they live in an area with a dentist shortage, like was discussed earlier in this conversation, we give them the opportunity to use this AI-enabled home screening so that they can take pictures with their smartphone and have access to virtual dentists to review their results and set them up with next steps. So that's really impactful in addressing some of the barriers to care. We also think that affordability and benefit awareness is a key opportunity. So we offer the Oral Health Integration Program, or OHIP, which is enhanced benefits for pregnant members and members with other special conditions that reduce cost as a barrier. We also offer incentives and through discounts on certain services and products to also address the cost barrier. Next, I will mention First Grin. right? We've also partnered with CareQuest on First Grin and other enhancements to our Healthy Pregnancies, Healthy Babies program education and our new dental marketplace that has specialized curated content for expected mothers. But because oral health is not only important for the mother, but postpartum and to set the baby up for success and healthy patterns in life, we also distribute First Grin kits and provide this education to meet that need. So I think the opportunity is integration by design, not only offering maternity programs like Healthy Pregnancy, Healthy Babies, enhanced benefits like OHIP, enhanced resources and tools like SmartScan and First Grin and Dental Marketplace, but making sure they work intentionally together to help normalize oral health as part of prenatal care and yield the right outcomes for mothers and babies.
Yes, could not agree more. Really putting the patient first and trying to make the experience as seamless as possible, whether it's on the medical or the dental side, should be one connected system. Well, thank you for all those examples, Sandra, and for you and the Cigna team's leadership in this space. It's also been a pleasure to work with you on some of those initiatives over the years. Okay, last lightning round question, similar to the first panel. We'll ask each of you to answer. If you could unlock one change in the next 2 to 3 years to better integrate oral and women's health, what would that be? And if you could really highlight who is a critical player that needs to act to make this happen. Dr. Lawson, happy to start with you.
Sure. I'll start. It would be for me likely broadening and strengthening the clinical guidance around that oral or dental exam with pregnancy. Of course, it wouldn't happen. You can't examine folks every visit, but usually on that first initial OB visit, if we could broaden and strengthen that. And the partners with that would be specialty society such as ACOG. And that's something I certainly am thinking I'll work on.
Love that. And a commitment and all.
Commitment to call to action right there.
Yes. Love it. Thank you, Dr. Lawson. Sandra?
Yes, I would just underscore that it would be most important to make oral health as a standard built-in aspect of prenatal care, not optional, not separate. And that way, women understand, right, why it's safe and important during pregnancy. They better understand how to access the benefits available to them, and they're more likely to get the care they need early in the process instead of after delivery. And it doesn't have to be something, brand new and different. It's about how we embed it in existing touch points, in existing prenatal visits, in existing maternity programs, in existing online and virtual resources, in postpartum visits. And who needs to act? I think that it's shared accountability, and the health plan plays a central role in partnership with providers and policymakers and public health officials and the broader community. And what the health plan can do is focus in on aligning benefits, on embedding oral health into maternity programs, and on investing in data interoperability and connectivity, because if we don't have access to the information, right information, we can't act on it. So it doesn't require breakthrough technology. It's more about an intentional system design to bring these pieces together and really normalize and standardize, integrate, embed oral health and improve outcomes for women and babies and address disparities at the same time.
Very well said, and want to thank you both again for taking the time to be here today and also your leadership in this space. We've heard a lot of consistent themes across the panels today, and the evidence is there where the solutions are even out there as well. The work now is really making it operational and scalable and ensure it can reach all. And so I think that is the challenge ahead for all of us. And so I'll turn it back to Gina to introduce our final topic. Thank you.
Amazing. Thank you to our last group here. I don't know about the rest of you on the line, but I am pretty fired up about the topics that we've talked about. I'm really excited to introduce Faisal Chaudhry, also from the CareQuest team, who's actually going to talk about how we can put some of these ideas and themes into actions through programs that are available to innovators. So with that, Faisal, please introduce yourself and I'll go ahead and get our screen up.
Yes, thank you, Gina. Thank you for that introduction. My name is Faisal Chaudhry. I'm a senior manager at CareQuest Innovation Partners, and it's a pleasure to be with all of you today and talk about the programs that CareQuest and Matter put together to support startup innovation. As you've already heard today, we have an accelerator for emerging startups called Smile Health, and a non-dilutive funds program for more established companies called Accelerate. Now, I'm going to start with Smile because applications close in less than 2 weeks for that on May 13th. So to learn more about both programs, you can visit our website. The link is in our chat, and we'll pull it up on the screen in a moment as well. But if you go to our website, carequestinnovation.com, right on the home page, you'll actually see a button to click for Apply Now, and that's where you can learn more about Smile. So now in its 5th year, Smile Health is a one-of-a-kind accelerator. We support startups improving access, equity, and integration of oral and overall health. It's open to startups from across the world. Most years we have almost 100 applications, including from a dozen or more countries outside of the United States. And what's required is your solution must have an oral or integrated health use case. You must be in market or ready to go to market in 6 to 12 months, and you need to have time to participate in the 4-week program. If all of those things are true, then we definitely highly recommend that you apply to Smile. As part of Smile, startups receive dedicated pitch support from our team of experts, which have helped dozens of startups in the past 5 years in their go-to-market strategies. Partnership support to help you prepare for individual conversations with potential customers and investors, a $2,500 non-dilutive stipend, and most importantly, time on stage at Demo Day, which is the culminating event of Smile Health, which I'll get into in a little bit. In terms of timeline, like I said, applications close May 13th. That isn't this coming Wednesday, but it's the following Wednesday. We'll select the cohort by the end of June. The program will run for the month of July, and then Demo Day, that culminating event, will be the end of July. You're welcome to visit our website. You can learn more about what previous startups and partners have said about our program. And finally on Smile is this list of partners which participate. Like I said, Smile wraps up with Demo Day, and that's where we invite executive and senior leaders from all of these companies and VC firms on the screen to Chicago in person to meet with Smile cohort companies. And every year we have leaders come out from provider groups, like Heartland and PDS Health, payers like some of the ones you've heard from today, Cigna, Blue Cross, the Delta Dentals, CPG companies like Colgate and Haleon, manufacturers and distributors like Henry Schein, Solventum, Young Innovations, who you've heard from earlier today, and finally investors, Seven Wire, SIA, the Dental Innovation Alliance, which Kentucky is part of. So if you're part of this cohort as part of Smile, you get a unique opportunity to not only pitch in front of all these folks in person, but also meet with them one-on-one. We'll set up curated conversations and try to match your interests with the partner interests and with the investor interests so that you all can learn more about each other and explore potential next steps. So that's Smile Health in a nutshell. Like I said, it's for earlier stage companies, typically seed or pre-seed, though we have had companies all the way up to Series A. Our other program, which we can move to now, is Accelerate. And that supports more established companies, typically Series A and beyond, which already have substantial market traction. And we fund pilots of their solution with up to $100,000 of non-dilutive funds. So again, on our website, you can see we have a page on Accelerate. And the purpose of this program is to support companies by decreasing the time it takes for them to pilot their new solution, their solution in a new setting, with a new customer, or rolling out a new feature. It supports companies by decreasing the risk that comes with those types of innovations, by providing financial and advisory support. And finally, it helps companies develop long-lasting partnerships by proving out the financial and clinical ROIs that are often missing and that their companies need to successfully scale. As part of Accelerate, companies can receive up to $100,000 of non-dilutive funds for an in-market deployment of their solution over a 6 to 12 month time frame with a potential customer. We call that potential customer an industry partner. So earlier today, you heard an example of an Accelerate partner, Murnia being the company and Young Innovations being the industry partner who's helping Murnia in their in-market deployment. Along with those non-dilutive funds, however, CareQuest also provides substantial advisory and analytical support to scope the project and to track, measure, but most importantly, drive towards meaningful outcomes for your company as well as your partner. Companies with an active Accelerate project this year will also be invited to attend Demo Day in Chicago. So you'll also have that opportunity to pitch your solution and network with leaders from our ecosystem of industry and investor partners. So you should apply to Accelerate if you already have a well-developed solution with significant market traction, as well as an industry partner who can support a project, which advances our mission of increasing access, equity, or integration of care. We're particularly interested this year in solutions which expand access to care via virtual or preventive care models, solutions which advance medical dental data exchange, and solutions which focus on high-need populations with chronic conditions. And I think throughout the panels today, you heard about why we are so interested in those three areas in particular. So unlike Smile, applications for Accelerate are accepted year-round. So there isn't a hard deadline, but I do encourage everyone to apply early because there is a set pool of funding available this year. And you can read more about the application process online. It starts out by filling out a form linked on the top of this page. And then if you like the proposal, we'll reach out to you to ask for additional information. We'll help you scope the project and those outcomes, and we'll meet with your partner to better understand what you're looking for. Now, that's from the company's perspective. If you're an incumbent in this space, if you're a potential industry partner, and you're looking to work with a startup in this sort of framework, please reach out to our team, and we'd be happy to talk through any ideas you may have to quickly scale innovation within your company. And finally, at the bottom of the Accelerate webpage, we have a few case studies linked, which highlight successful Accelerate projects so you can learn more about our work and how we can work with your organization in the future. I know you heard from Murnia and Young earlier, but a couple other projects I can mention is over here. One is a telehealth company, which was successful in the restorative market, but wanted to expand into the hygiene market. So they piloted their solution to almost 20,000 patients over a 12-month time frame. We're also currently wrapping up a project with a novel oral cancer screener. They're piloting their solution in a mobile setting with medically underserved populations. And then finally, it's not published yet, but we'll be coming out with that soon, is a case study on a maternal health solution, which is very successful in the commercial in the commercial market. And they've been able to successfully pilot their solution through Accelerate in the Medicaid market for the first time. And will hopefully be scaling their solution in that population in the near future. So if Accelerate sounds like a good fit for your company, please, again, reach out to our team or fill out an application, and we'd absolutely love to work with you to advance our mission of improving the oral health of all. So with that, before handing things back over to Gina to wrap up, I just wanted to say thank you on behalf of CareQuest for all the panelists who joined us today to share their experience, as well as Matter, our Zoom host. CareQuest has been partnering with Matter to support innovation in oral health for the past 5 years, and we look forward to continuing that work together with all of you on the call. So Gina.
Thank you, Faisal, for sharing just really kind of these two very exciting programs and all the ways that people can participate across them, whether you're a founder, a startup, an innovator, or established industry partner. With that, we've come to a close. I do encourage everyone who is with us on the call, check out the chat. We've dropped in some contact forms. We've dropped in some of the web pages that we just covered off today. And we encourage you to visit us frequently so that we can stay in touch. So thank you for your time today.